Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, today we can discuss questions from Pediatric Nursing. In the previous video, subject-wise discussion, Community Health Nursing, 3 part we completed. Today we can start another subject, that is Pediatric Nursing. We can see the questions from Pediatric Nursing. Let's start the question. First question. At the time of birth, head circumference is about, and the options are option A 12 to 13 inches, option B 13.2 to 14 inches, option C 14 to 15.2 inches, and option D 14 to 15.6 inches. Okay, head circumference in inches, that is the question. So correct answer is option B 13.2 to 14 inches. In inches, okay, not in centimeter. Option B is the correct answer. If it is in centimeter, it is 33 to 35 centimeter. Okay. And the second question, at the time of birth, the chest circumference is about. Options are option A 12 to 13.2 inches, option B 13.2 to 14 inches, option C 14 to 15.2 inches, and option D 14 to 15.6 inches. Here correct answer is option A 12 to 13.2 inches. The chest circumference in inches. Okay, and if it is in centimeter means 30 to 33 centimeter. Question number 3. Capillary hemangioma, which is raised, clearly delineated, dark red, commonly in head regions, is known as. Options are option A Mongolian spot, option B Nevus flammeus, option C Nevus vasculosus, option D milia. Here question is capillary hemangioma, which is dark red and is seen in the head region, that is known as Nevus vasculosus. Option C is the correct answer. This Nevus vasculosus is also known as strawberry mark. This is one of the birth mark which is seen in the babies. Here the nevus vasculosus means it is a capillary hemangioma, which hemangioma means one of the birth defect which have extra blood vessels. So it is raised, clearly delineated, dark red, and it is commonly seen in the head region. Okay, and this disappears by the age of 7 to 9 years. Okay. The other options, option A Mongolian spot, that is also one of the birthmark, and Nevus flammeus is there, that is also birthmark. Okay, milia is a small white rashes seen in baby. Question number 4. A nurse is assessing a newborn who has born to a mother who is addicted to drugs. Which assessment findings would the nurse expected to know during the assessment of this newborn? And options are option A lethargy, option B sleepiness, option C infant crying, option D curdling when being held. In this question, a nurse is assessing a newborn who is born to a drug addicted mother. Okay, while doing assessment, what the nurse is expect from the newborn, or the nurse can expect from this newborn, that is the question. So, a newborn which is born to a drug addicted mother is always irritable. One of the sign of this irritability is crying. Okay, so answer will come option C infant crying. First option lethargy or sleepiness, that will not come. Always infant is irritable and crying. So option A and B is not correct. And curdling when being held, or here the baby is irritable, because of that the baby will be hyper extended instead of curling posture. Okay, so here correct answer is option C. Question number 5. Spina bifida occurs due to. Options are option A neural tube defect, option B congenital defect, option C accumulation of blood in brain, option D chromosomal abnormalities. Spina bifida occurs due to, it is a spina bifida is a neural tube defect. Option A is the correct answer. The next question, which is the most severe type of spina bifida? Options are option A spina bifida occulta, option B spina bifida cystica, option C myelomeningocele, and option D meningocele. And the correct answer is option C, myelomeningocele is the most severe type of spina bifida. The types of the spina bifida include spina bifida occulta, spina bifida cystica, meningocele, and myelomeningocele. Among this myelomeningocele is the most severe type of spinal bifida. Okay, this Y means this myelomeningocele which affect the spinal cord as well as the spinal nerve. And the next question, and easy question, total lung capacity in a newborn is. Options are option A 100 ml, option B 150 ml, option C 500 ml, option D 350 ml. Lung capacity, total lung capacity in a newborn is option B 150 ml is the correct answer. And the next question, which of the following helps in prevention of neural tube defects in infants? Options are option A iron supplement, option B vitamins, option C folic acid, option D all of this. Correct answer is option C folic acid. Folic acid which prevent neural tube defects in fetus. Okay, so the pregnant woman, they are consuming this tablet folic acid. Why means to prevent the neural tube defect in fetus. And the next question, at which month of age the head control is possible in infants? Options are option A 2 months, option B 3 months, option C 4 months, and option D 6 months. Correct answer is option B 3 months. This head control is one of the gross motor development or gross motor milestone which is occurs at the age of 3 months. Okay, this head control and neck control occurs at the age of 3 months. Okay, option B is the correct answer. The next question and 10th question, tripod position is possible at which month of age? Options are option A 3 months, option B 4 months, option C 6 months, and option D 9 months. Tripod position is possible at the age of option C 6 months. Also by this 6 month baby can sit with support, that is also in 6 month. And also weaning we are starting at the age of 6 month, and birth weight doubles at the age of 6 month, and the baby smile at a mirror image also by 6 month. Here our question is tripod position is possible at which month of age? That is 6 month of age. Option C is the correct answer. And the next question, a child can able to draw a triangle at the age of. Options are option A 3 years, option B 4 years, option C 5 years, option D 6 years. A child can able to draw a triangle at the age of option C 5 years. Child can able to draw a circle at the age of 3 years, can able to draw a rectangle at the age of 4 years, and triangle at the age of 5 years. 3 years, circle, 4 years, rectangle, 5 years, triangle. And the next question, in primary teeth eruption, the first molar teeth eruption occurs at the age of. Options are option A 9 to 12 month, option B 12 to 15 month, option C 18 to 21 months, and option D 16 to 18 months. Here correct answer is option B 12 to 15 months. In teeth eruption, there is primary teeth eruption is there, and also permanent teeth eruption is there. This primary teeth eruption which occurs at 6 months of age, and permanent teeth eruption start at the age of 6 years. Okay, this primary teeth eruption occurs like 5 to 8 months of age, there is lower central incisors, or 6 to 8 month of age lower central incisors, 6 to 9 months of age upper central incisors, 9 to 12 months of age lateral incisors, 12 to 15 months of age first molar teeth, and 18 to 21 months of age canine teeth, 21 to 24 months of age second molar teeth. Here our question is first molar teeth which occurs in 12 to 15 months of age. Option B is the correct answer. And the next question, question number 13. In which age group diphtheria is commonly found? Options are option A 1 to 2 years, option B 2 to 3 years, option C 1 to 5 years, and option D 3 to 10 years. Correct answer is option C 1 to 5 years. The common age group of diphtheria is 1 to 5 years. Option C is the correct answer. The next question, the usual age of one set of infantile beriberi is. Options are option A 2 to 3 months, option B 6 to 8 months, option C 10 to 12 months, option D 4 to 6 months. Here correct answer is option A 2 to 3 months of age. The infantile beriberi is a nutritional deficiency disease which occurs due to deficiency of vitamin B1 is thiamine. The usual age of one set of this infantile beriberi is between 2 to 4 months of age. Here in our option 2 to 3 months is there. That's why that is correct answer, option A. And the next question, total number of features in Apgar score is. Options are option A 4, option B 5, option C 6, option D 7. Total number of features in Apgar score. Correct answer is option B 5. The 5 vital indicators of this Apgar score include heart rate, respiratory rate, muscle tone, reflex irritability and skin color. Heart rate, respiratory rate, muscle tone, reflex and skin color. These are all the 5 vital indicators of Apgar score. And the next question, the baby is considered normal if the Apgar score is. Options are option A more than 8, option B more than 10, option C between 5 to 8, option D between 4 to 7. Here the correct answer is option A more than 8. The interventions of this Apgar scoring is between 8 to 10. The score is between 8 to 10 means the baby is normal, baby is just okay baby. And if it is 4 to 7 means the baby need gentle stimulant and we have to administer oxygen to the newborn. If it is 0 to 3 means the newborn required resuscitation. Okay. The next question, if the birth weight of a newborn is 3 kg, then on 5th day weight will be. Options are option A 3 kg, option B less than 3 kg, option C 3.2 kg and option D 3.1 kg. And the correct answer is option B less than 3 kg. Why? Because due to the adjustment in external environment, some weight loss will be occurs in the newborn. So the weight will be less than 3. Okay, so option B is the correct answer. The next question, at which temperature DPT vaccine should be stored? And the options, option A minus 20 degrees Celsius, option B 0 degrees Celsius, option C 4 to 8 degrees Celsius and option D 20 degrees Celsius. Correct answer is option C 4 to 8 degrees Celsius. DPT vaccine should be stored at 4 to 8 degrees Celsius. And the next question, highest incidence of pertussis is found in the age group of. Options are option A 0 to 2 years, option B 0 to 5 years, option C 2 to 7 years and option D 1 to 10 years. Highest incidence of pertussis. Correct answer is option B 0 to 5 years. This pertussis is also known as whooping cough or 100-day cough, which is caused by Bordetella pertussis. This is mainly occur in the age group of 0 to 5 years. And the next question and the last question in the series, what is the age of toddler? Options are option A 0 to 1 years, option B 1 to 3 years, option C 3 to 5 years and option D 0 to 2 years. The age of toddler is option B 1 to 3 years. 0 to 1 years is infancy. 1 to 3 years is toddler and 3 to 5 years is preschooler. Our question is 1 to 3 years, that is toddler. Option B is the correct answer. So far we discuss some of the important questions from pediatric nursing, and the remaining question we can see in the next video.